Administering an oral tablet or capsule. This process is giving a medication by mouth to the animal, either by a pet pillar, a balling gun, dosing syringe, drench gun by hand, or hidden in food and many other options. Now, this practicum specifically focuses more on an oral tablet or capsule by mouth into a smaller animal in a vet clinic, but other types of ways, including like the balling gun and dosing syringe, may be used on a wide variety of livestock in the industry. Oral medications can be tablets, capsules, liquids, and different species will require different techniques to administer. A vet assistant, a vet technician, or the veterinarian in a vet clinic can administer oral tablets or capsules. Step 1 is to read and interpret the veterinarian's order. You want to make sure that you are using the proper medication and the proper dosage of that medication and the proper strength of that medication. Select the correct drug and that concentration. You will open the mouth of the animal. This can be used with your hands to go ahead and to ply the mouth open. Maintain control of the head or muzzle during the administration of the medication. And then use an appropriate technique to encourage the patient to swallow. This can be holding the mouth closed and rubbing on the throat of the animal. You can put the mouth closed and blow on the nose of the animal to encourage them to swallow, or even also administer a small amount of liquid into their mouth through a syringe that allows that animal to swallow a little easier. Control the animal in a manner that is adequate to administer the medication, yet did no harm to the patient.
Today I'll be properly demonstrating how to administer an oral tablet or medication. This is really easily done and very commonly done with owners at their house and even as veterinary assistants or technicians in the clinic taking care of hospitalized patients. It's very important to understand the different concentrations and the medication we're giving. If we don't understand how the medication works and how to give it, then we shouldn't be giving that. And that is things for us to discuss with the owner as well so they understand. So today we'll be giving Millie, Miss Anderson's dog, her gabapentin. She got sprayed the other day and she needs her pain medication. So this says to give 1 to 2 capsules orally 2 times a day as needed for pain. Millie seems to be pretty painful this morning, so we're going to be giving 2 whole capsules. And so this is gabapentin, 100 milligrams. So I just want to open the bottle and look at the medication and make sure that I know this is gabapentin 100 milligrams. It's very easy to differentiate different size and concentration of a drug if you're in the field for every day. It's hard for the owner to differentiate that, so we do need to make sure that this is filled correctly as well. When we're ready to give the medication, it's important to know the different methods to give the medication. There are a lot of different methods. It could be as easy as hiding it in some food, but for some patients it's not that easy. Other times we can drop the medication in the back of their mouth, blow on their nose. That'll encourage them to swallow. We can put the medication in the back of their throat and just syringe a little bit of water into their mouth, and that will encourage them to swallow. Or if we place that medication in their mouth and hold their mouth shut and rub their neck, that will encourage them to swallow as well. When I'm ready to give the medication, I'll go ahead and read the veterinarian's orders one more time to make sure that I have the correct drug and concentration and giving it to the right patient. I'll go ahead and open the mouth and drop that tablet in the back of their throat. I'll go ahead and close their mouth and just allow him to swallow. I'm going to properly demonstrate how to administer an oral medication. I'm going to start by reading and interpreting the veterinarian's order. Today we will be giving Previcox 57 milligram tablet, 1 whole tablet. After selecting the correct drug and concentration, I'm going to open the mouth of the animal and control the head or muzzle during the administration of the medication. I'm going to use appropriate technique to encourage the patient to swallow, and I was able to control the animal in a manner that was adequate to administer the medication and did not harm the patient.
So in summary, to properly administer an oral tablet or capsule, You would read and interpret the veterinarian's order, select the correct drug and concentration, open the mouth of the animal, maintain control of the head or muzzle during the administration of the medication, use an appropriate technique to encourage the patient to swallow, and then control the animal in a manner that is adequate to administer the medication, yet did no harm to the patient.